Right, let's look at the right knee. So far, the main obvious thing for your right knee is, so you see this middle line here?
Mm-hmm.
It's slightly on the outer side.
Mm-hmm.
Yeah, compared to the left side. Left side is quite straight. This
Uh-huh.
is on the outer side. So it's off by probably a few degrees. I couldn't really tell. But yeah. So, okay. You look at this joint first, okay? So the problem is when your tibia is slightly on the outer side, there's a misalignment of this patella because it it's not on the right track, because right now your track is slightly like this, but it still go up straight like that.
Uh-huh.
Yeah, okay? Because the one down here, it's rotated outside slightly.
This
Yeah.
one. This one is
Yeah, it's slightly, there's a curve there, so it's slightly here rather than here. Slightly there. You notice that?
yeah.
Yeah.
Interesting.
Yeah, so when you have that, so whenever you do, whenever you do squats, there's an extra torque there because your knees wants to go like this, but then your foot sort of maintain here rather than the right side is more angled, because once it's more angled it's easy to collapse, right?
Mm-hmm.
So you try to maintain here, but then since it's already rotated, so the knees needs to flare up a bit or it needs to go in a bit more, so there's a lot more shifting and movement there, so
Mhm.
the patella cannot really sit and glide. There's a torque between it.
Mhm.
Yeah, so it keeps on rubbing on a certain angle, and the structure on top, especially here, so this whole tendon, it holds on to the patella, and the muscles that holds it sort of pulls it right into the place it is. But right now the outer side is a lot tighter, because he needs to do a lot more work in terms of pulling it, because he needs to pull slightly on the outside.
Mm-hmm.
Okay, so what I will do is release all this, bring it to the middle a bit, and then strengthen this one here so you can hook it in. Yeah, okay, so we get slightly more space, rather than it's outside all the time. So it's not a one-time thing where I can just do some spell and then it's straight all the way.
Mm-hmm.
So you need to do some exercises to help it maintain inside as well.
Mm-hmm.
Yeah, and you're familiar with it, right?
Mm.
Yeah. So, and then also another thing that we need to work on is your eccentric power. So your capability to really go low and sustain there, because that's where the pressure is much higher on the kneecap. Because
Mhm.
it keeps on pressing it. So
And I squat all the way down. Or
yeah. So it's either you go all the way down or you go up all the way. You cannot stay in the middle.
mm-hmm.
90 degrees will be the hardest for you.
Mm-hmm.
I assume. Yeah. Yeah. So it's quite common. It's just that there's work to do. Yeah.
Mm.
Yeah. So far makes sense?
Yeah, this explains why after you did a bit of the hip flexion exercise and you did hamstring work, then this week you have much less pain already.
Yeah. Oh, also your IT band and your hip flexion is tight on the right side. Hip flexion tight on the right side, I'm not really sure why, but the IT band I understand because it holds on to this area. So it could be, which one comes out first, chicken or egg?
Mm-hmm.
Could be either one. So
Mhm.
yeah, I'm just gonna settle this, the whole IT band, and then stabilize it again and see what's missing when you do your exercises. Because sometimes not firing, this one not firing. Yeah,
Do you think it's I had this condition since birth, or?
I don't know. I don't think so. It's more of something you build along the way.
Mhm.
But the chances of it having still since birth is still there, but most commonly it's
Mm.
done. That's why when I asked for sports just now, because we see this in footballers when they dribble sideways.
Mm.
There's a lot of lateral movement. So yeah,
Mm.
so they do that. That's why I asked you if you're dominant on your right leg,
Mm.
because let's say in climbing, you reach using your right leg more, you push using your right leg more, and then the left side is just where you stabilize or you help the right leg. The right leg is the dominant one that pushes, that reaches, that stabilizes. Yeah.
Yeah, he's right dominant when he climbs.
Yeah.
And he smashes the wall.
Okay. Yeah, that could explains.
And then again, it's always the left shoe that wears out quicker.
But you smash your right.
But you observe me more, so
I've been believing you all the
Yeah.
time. So.
you're probably right.
Yeah. Okay.
All right.
So, makes sense. All right. Okay. Just let me